Welcome to today's webinar entitled Scratching the Surface of Peristomal Itching, the Invisible Peristomal Skin Concern. This session is part one of a two-part series on peristomal itching. Today, we will discuss peristomal skin complications and focus on peristomal itching, an often invisible peristomal skin concern. We will begin with looking at the skin around the stoma, comparing healthy peristomal skin to skin with visible complications. We will then discuss itching that occurs in the presence of visible complications, as well as itching that occurs with otherwise healthy-looking skin, as reported by both healthcare professionals and those living with an ostomy. We will conclude with a look at the role of the skin barrier in maintaining peristomal skin health. We will talk about how the right skin barrier fit plus formulation can help prevent peristomal skin complications, and how ostomy skin barriers infused with an ingredient called Ceramide are designed to help keep the skin around the stoma healthy. Let's get started. Before you can understand what is not normal or what a peristomal skin complication looks like, it is important to understand how healthy peristomal skin should look. While stomas come in a variety of sizes and shapes, the healthy stoma is pink or red in color, like the stoma pictured here, and is warm and slightly moist. The skin around the stoma, which is called the peristomal skin, should be intact, without redness, open skin, or irritation. The skin around your stoma should look like the healthy skin on the opposite side of your body. It is important to maintain healthy peristomal skin because it impacts how well your skin barrier and ostomy pouching system can adhere or stick to your skin. When your ostomy pouching system cannot adhere well, your peristomal skin is at greater risk for damage. If the skin around your stoma is damaged, it will look irritated and feel sore. A rash, redness, or irritation around the stoma could be a sign of a peristomal skin complication, or PSC for short. Peristomal skin complications can range from mild, like the picture you see on the left, to severe, like the picture you see on the right. All peristomal skin complications can impact how well the skin barrier can adhere and may have a negative impact on quality of life for the person living with an ostomy. A common cause of peristomal skin complications is leakage of stool or urine onto the skin. When there is leakage, it is easy to understand how there may be irritation to the skin, resulting in itching. In fact, many stoma care nurses teach patients to identify peristomal skin itching as a symptom of leakage. You may have even had your stoma care nurse instruct you, if your skin is itching, you should remove your barrier, clean your skin, and apply a new system. Skin complications aren't always visible. Your skin may itch even if it looks healthy. Peristomal skin itching is a common occurrence. People living with a stoma and otherwise healthy peristomal skin often complain of that need to scratch sensation. Itching, also known as peritis, is the uncomfortable sensation causing us to want to itch or scratch. When it's acute or time-limited, it may just cause temporary annoyance. When chronic or occurring often, peritis may be difficult to treat and have a more severe impact on your overall quality of life. If you experience peristomal itching in the absence of peristomal skin complications, you are not alone. A recent study by a stoma care nurse named Ginger Salvadalena explored this concept of peristomal itching in the absence of any visible peristomal skin complications from two perspectives, as reported by both people with stomas and stoma care nurses. She was interested in what we could learn from this phenomenon and wanted to find out if peristomal itching occurred, how often it occurred, and if it was considered a problem. 164 people living with a stoma in the United States and the United Kingdom, as well as 259 stoma care nurses from the United States and Canada, participated in this study. You may have participated in this study. If so, thank you for providing your opinions. Let's start with the perspective of people with a stoma. When asked about how often they felt the need to scratch, the study found 87% of people living with a stoma experienced peristomal itching. Nearly 3 in 5 people said they felt the need to scratch at least occasionally. About 16% of those said they experienced this feeling frequently or very frequently. The study then asked those people who experienced itching how their skin looked. 40% said their skin looked damaged or irritated at the time they experienced peristomal itching. In comparison, nearly as many, or 36%, said their skin looked healthy at the time. Now for the healthcare professional's perspective. Among stoma care nurses that were surveyed, over 95% have had patients report pruritus. Of those stoma care nurses, 27% said pruritus was the primary reason for the patient's visit. When asked how bothersome this condition was for their patients, 7 in 10 nurses reported it was at least moderately bothersome. In addition, the survey found 71% of nurses said they recalled a time when a patient reported itching while their peristomal skin appeared healthy. The nurses cited dry skin as the most common cause of itching among those individuals with healthy peristomal skin. In summary, this study highlights the experience of itching in the absence of peristomal skin complications. 87% of people with a stoma surveyed reported peristomal itching. 36% of the time, though, they said their skin appeared healthy. In addition, 71% of nurses surveyed said they recalled a time when a patient reported itching while their peristomal skin appeared healthy. Opinions varied about the main causes, but we know itching in general is more than just an annoyance and impacts the quality of life for the person with a stoma. So, what can be done here? Let's discuss the role that the ostomy skin barrier plays in helping to maintain healthy peristomal skin. To preserve healthy peristomal skin, there are 2 functions of the skin barrier that must come together: fit plus formulation. To help you understand this, I'm going to ask you to think of a pair of eyeglasses, where the frames are the fit. These frames were sized to fit your face. And then there is the prescription, which was prescribed to you by your doctor. Together, they make a customized and unique set of glasses only for you. Your glasses fit plus formulation may not work for somebody else. Choosing an ostomy pouching system is very similar. You may have worked with an ostomy nurse who assessed your stoma, abdomen, and skin to help choose the right barrier fit to help prevent leakage. There are many different barrier fits, such as flat, soft convex, firm convex, cut to fit, pre-sized, tape, and tapeless options. But selecting the right formulation or the ingredients inside the skin barrier that interface with the skin is equally important. The ingredients inside all skin barriers that make up the formulation work together to provide 3 main things, or performance characteristics. Adhesion, to adhere or stick the pouching system to the skin. Absorption, to absorb moisture from the stoma or perspiration on the skin. Erosion resistance, to hold the skin barrier together in the presence of fluid and provide the right wear time. Different skin barrier formulations are available to serve different needs. For example, some with gentle adhesion for delicate skin or for more frequent changes, or some with the ability to absorb liquid slowly to help improve wear time for people with more liquid stoma output. You may be familiar with the terms standard wear or extended wear to describe a type of ostomy skin barrier. This is related to the ingredients or formulation of the skin barrier. Now there is a newer type of skin barrier formulation called an infused barrier, which contains an additional ingredient such as manuka honey, aloe vera, or ceramide. The CeraPlus skin barrier from Hollister Ostomy Care is an example of this type of skin barrier. This infused barrier has all of the same characteristics as other skin barriers: adhesion, absorption, and erosion resistance, plus the added benefit of ceramide. What is ceramide? Ceramides are a natural component of human skin consisting of waxy lipid or fat molecules. It is the most abundant waxy lipid found in the outermost layer of your skin. Ceramides play a critical role in maintaining skin health. One way to think of the role of ceramide in skin is to think about a solid brick wall. In this example, healthy skin cells, the bricks, of the epidermis are linked together with the ceramides, the mortar, to help form a waterproof protective barrier. Because the water is inside the skin, having this wall in place makes it difficult for the water to pass through, out of the skin, so it does not get dry. When this waterproof protective barrier is as healthy as it can be, it may help minimize the impact the external environment has on the skin, especially peristomal skin that is at risk for leakage and frequent skin barrier removal. Another role of ceramides is to help retain moisture. The naturally occurring lipid, ceramide, may help decrease water loss through the skin, called transepidermal water loss, or TOOL for short. Transepidermal water loss is a measure of the amount of water that evaporates or diffuses through the skin naturally. Healthy skin has reported high levels of ceramide, while unhealthy skin often has lower levels of ceramide. An abundance of ceramides, or waxy lipid molecules, helps the skin retain its natural moisture and help prevent water loss that may lead to skin damage, dryness, and itching. Hollister is the first company in the U.S. to introduce a skin barrier infused with ceramide designed to help keep peristomal skin healthy right from the start. The CeraPlus skin barrier features an extended-wear ceramide-infused formulation to help protect the skin's natural moisture barrier, decrease transepidermal water loss from damaged or eroded skin, and maintain good peristomal skin health. Ceramides are found in cosmetics, lotions, and creams. As you may know, it is not recommended to use any lotions or creams on your peristomal skin because it may interfere with the barrier's ability to adhere to the skin. The ceramide in the CeraPlus skin barrier is infused into the barrier formulation, so it does not interfere with the ability of the skin barrier to adhere to your skin. We are coming to the close of this session on itching, a peristomal skin concern about which we are just starting to scratch the surface. We know dry skin can lead to itching under the skin barrier. Itching under the skin barrier is often overlooked because the skin might appear like nothing is wrong. This leads to frustration for the person living with a stoma and the stoma care nurse. It's hard to resolve something you can't see. This session helped give you a better understanding of how ceramides, a natural component of human skin, can help protect against dryness that can lead to itching. It also discussed a type of product option, the infused skin barrier, such as the ceramide-infused skin barrier from Hollister Ostomy Care, that is designed to help maintain healthy peristomal skin. Part 2 of this series will dive deeper into peristomal itching and discuss the impact of peristomal itching on quality of life and cost of care. You will also learn about the Advocate Study, a recent multi-country clinical trial that looked at the impact of the ceramide-infused CeraPlus skin barrier on healthcare costs and peristomal skin health. One patient-reported outcome of this study, stated, significantly more participants were very satisfied with the CeraPlus skin barrier at prevention of itching. To learn more about the Advocate study, please join us for part 2 of this series entitled Digging Deeper into Peristomal Itching, the Invisible Peristomal Skin Concern. If you would like assistance or additional resources on the information discussed in this session, or have questions about living with an ostomy, please call Hollister Secure Start Services, and a member of our team may be able to assist you. Hollister Secure Start Services provides free support to people living with an ostomy, regardless of the brand of products you use. Thank you.